Disclaimer: this video is for educational purposes only and is part of an occupational therapy student assignment. The content presented, including assessments, interventions, and recommendations, is not intended to replace professional medical advice or treatment. The scenarios depicted may be simulations or role-playing exercises and should not be interpreted as a real-life medical consultations. Always seek the advice of a qualified healthcare professional for any medical concerns or conditions.
What is tactile hypersensitivity? Tactile hypersensitivity, or also known as defensiveness to touch, is a condition that affects the way a person perceives touch, causing difficulty with light touch and making it feel like a strong touch or even pain. It can also make it challenging to tolerate certain textures. These are the symptoms of tactile hypersensitivity. An individual becomes dysregulated, upset, or anxious with light and unexpected touch. An individual experiences difficulties walking barefoot on textures like sand, grass, or carpet. And individuals are also bothered by certain textures of clothing or the tag on the clothing. A 4-year-old girl diagnosed with tactile hypersensitivity. She is then referred to occupational therapies for sensory integration therapy.
To manage this case, occupational therapists will follow the OT process, which includes evaluation, intervention, and the outcome.
Evaluation is done by collecting and interpreting information to establish targeted outcomes. Evaluation is focused on finding out what the client wants and needs to do, identifying supports and barriers to health, and client's participation. Evaluation includes new information about clients' needs, problems, and concerns. Assessment is done based on the sensory profile. The problem can be identified as client avoids going barefoot on the sand and client reacts emotionally to the stimulation. For example, client cries, screams, and fights.
Next is the intervention. So intervention is designed to enhance clients' health and well-being and make it easier for them to engage in occupations. It includes 3 phases, which are intervention plan, intervention implementation, and intervention review.
For this case, we have a few intervention plans, which include brushing, positive reinforcement reward system, and also sensory exploration. This plan is to help lower their tactile defensiveness, along with encouraging the child to explore more texture in their surroundings. For brushing, we will use the wheel-budger brushing protocol, which will use a specific kind of brush called wheel-budger TheraPressure brush. The steps are really easy. You just have to brush up and down the arms and the legs for at least 3 times, scrub the palms of the hand and bottoms of the feet for at least 5 seconds, and then brush up and down their back for at least 3 times. Next is the positive reinforcement reward system, which is a method to teach children about good behavior by giving them reward for it. And for this case, we will give stickers to the children as a reward for their commitment in joining the activities. Lastly, sensory exploration. For this part, we will use the self-directed tactile experiences method, which include activities like bubble play, mud activity, and sand play. This method is used to encourage child to explore more texture that they didn't like. It will help them to slowly be comfortable in various different textures in their surrounding.
And at last is the outcome. So outcomes are results clients achieve through the intervention. it is the end result of the OT process. So the outcome was good. Patient has shown improvements. Patients receive good family support and the treatment is done at home. They comply greatly towards the treatment and patient is planned to be discharged. Here are a few recommendations of tactile activities that parents can do at home.
Thank you for watching.